Alright, as always, you can go to YouTube channel My Medical Nightmare and see 40 plus hours video on everything that happened to me after a devastating cyber attack hit the computer systems of major U.S. health provider Ascension. 19 states, 140 hospitals, 160,000 associates, 36,000 affiliated providers. Now, an interesting thing has happened in the public discourse following this cyber attack. As you can see, in over 60 hours of video documentation, recorded phone calls, uploaded medical records, and correspondence between Ascension, its affiliates, its partners, etc. on this YouTube channel. Ascension is a bad business. They're rife with corruption. They're responsible for damage to countless numbers of people. June 25th, 2024. UAB to acquire Ascension St. Vincent's hospital system in $450 million deal. This is according to AL.com. Included in this agreement is a change of hands in ownership to St. Vincent's Hospital in downtown Birmingham, St. Vincent's East, St. Vincent's St. Clair, that's in Pell City, St. Vincent's Blount, and St. Vincent's Chilton. Physician offices are also included, the freestanding emergency department in Trussville, the 119 campus and imaging centers, as well as current Ascension St. Vincent's services, facilities, caregivers, associates, and their network of providers. This deal is reportedly in the works since 2023. It could be finalized by the fall 2024, pending approval by regulators and the Catholic Church. UAB says they are hopeful that most, if not all, of the Ascension St. Vincent's roughly 5,000 caregivers and associates will remain in their roles. Additionally, UAB and Ascension St. Vincent's have had an operating agreement since 2020. The representative says UAB Health System plans to operate the hospitals without any changes and has no plans to eliminate or consolidate services. This development raises many questions, answers for which are apparently not forthcoming. I will assume that there are many behind-the-scenes details related to this that have not been publicly acknowledged. And before this thing moves forward, there need to be public hearings and public inquiry. First of all, the timing of the announcement, highly suspicious. Tuesday, June 25th, 2024. The week following that is, of course, 4th of July holiday. And by the time people get back to work on Monday the 8th, this news may well have slipped from people's minds. So the next thing you'll hear about this will probably be in the fall 2024 when the deal language clears. It looks as if Ascension is trying to beat a hasty retreat. They're rushing to the exits. And one possibility here is that Ascension was in fact ordered to sell its assets and leave the marketplace in central Alabama. Ascension is apparently under U.S. federal investigation. Others have accused Ascension of pump and dumps. They'll swoop into an area, buy up a group of hospitals and medical practices, and proceed to bleed them dry. Business ethics, medical ethics, morals, and the law go in the back burner, an afterthought, in the pure pursuit of amassing money and power. They start running into trouble with regulators and the law. They quickly sell off the hospitals and doctors. Alright, so in this video I'll cite one example if you want an idea of how counterintuitive, perplexing this sale to UAB actually is. The medical and healthcare business in central Alabama is a pure growth industry. Drive past St. Vincent's Hospital in downtown Birmingham on any given weekday. Parking lots full, parking decks full, no parking spaces, waiting rooms full. The waiting list for procedures in this hospital, months and months long. On the eastern side of the Birmingham metro area, Ascension St. Vincent's now enjoy a majority share of the healthcare business. And it makes absolutely no sense why they would all of a sudden want to leave this very profitable endeavor. The press is quoting $450 million for 5 hospitals. This stuff is literally being sold pennies on the dollar. Go look at the tax records for Ascension St. Vincent's in Alabama. Here's an example. This is one hospital, St. Vincent's, Birmingham. Annual revenue for 2022, $498 million just for that year. You can see the chart here. The amount of money that they're earning is growing yearly. If one hospital does $500 million in business in 1 year, why is Ascension St. Vincent's selling 5 hospitals and more for $450 million? This makes absolutely no sense whatsoever. My condition worsened and the infection grew. This is late summer. Getting into late summer 2019. I felt like I was dying. I decided to go to UAB Hospital, emergency department in downtown Birmingham, some weeks later for another diagnosis. UAB's emergency department is much different from St. Vincent's East Hospital in Birmingham, Alabama. The way they run it is a lot different. The space is small, crowded, dirty, old, with very little privacy for patients. Many unsecured infectious disease vectors exist in this environment. Among them, sick homeless people off the street, which apparently take refuge in the emergency department waiting room. I was sitting there and they talked to this one guy who came in and he said, "Oh, you're in here like regularly." So there's people that just come off the streets and they see him regularly there. And by far, the most common person I saw in this waiting area was an overdosing or overdosed or withdrawing drug addict. Another issue, disease vector, pathogen vector, infectious disease vector, is mosquitoes. There are mosquitoes that fly around in the waiting room of UAB Hospital emergency department waiting room. They have a public water dispensing machine. Poured me some water in a styrofoam cup. Little black worms, maybe half an inch long, dropped into my cup from the public water dispenser, where it's not cleaned. I can't drink that, I'm sorry. But thank you, UAB Hospital. Homeless people off the streets, mosquitoes, worms from the public water dispenser are not a good situation. UAB has a lot of money, though, apparently, as is evidenced by the massive sprawl of real estate that exists in Southside Birmingham. Go to Southside Birmingham, drive around, look at the schools, the hospitals, businesses. Look at the satellite businesses that exist around UAB that service UAB, serve UAB, take the overflow from UAB. Kind of like the place I went to. All around UAB, there's a medical industry, and it's all based around University of Alabama at Birmingham. Much of the staff in the emergency department at UAB is visibly young. The atmosphere is like a college dorm room. Many staff had fast food takeout and snacks on the triage area and ate and drank as they performed triage and medical procedures, emergency department medical procedures. It did not look like a professional environment. There's a long wait at UAB emergency department. I was told several hours for my triage condition, despite my serious symptoms. If you want to know my symptoms, check out some other audios and videos